Now, to officially kick off today's session, I am excited to introduce our first speaker. He is the Executive Director of Nursing at Hamad Medical Corporation, with over 20 years of experience in healthcare, specializing in emergency and acute care. With a PhD in management, he is also a prominent researcher in nursing management and AI-driven clinical decision support systems. Today, he will be presenting on revolutionizing nursing practice in the era of artificial intelligence. Please join me in welcoming Dr. Ahmad Abujaber.
Thank you very much. This is impressive. Before I start, I'd like to thank the organizers of this impressive conference. Thank this impressive attendance locally and internationally. I would like to thank you for bringing this very good subject to the light. We all know that one of the most important scientific advances in the modern history is the AI. It's coming our way whether we like it or we don't. So this approach is to embrace it and welcome it in open arms. The second reason for thanking the organizing committee is very personal reason, actually. This is the first time I come to my birthplace in Kuwait. I was born here many years ago, and I have wonderful childhood memories. So thank you very much for that. So I promise I will not bore you with high-tech technological terminology. It's just a high-level discussion about where AI fits in our practice. And we may discuss some, let's say, future research agenda for the enthusiasts for AI. So there are plenty of areas where junior researchers can target in order to advance the utilization or harnessing of AI in our practice. Actually, I can say that I specialize particularly in the machine learning and in the machine learning-based decision support systems. Therefore, most of my focus will be on machine learning in particular. So the background, actually, especially in healthcare, I think you all hear this phrase that we live in an era that is data-rich but information poor. And there are plenty of reasons for that. The technological advancement, advancement in computing systems helped us generate huge volumes of data. I think you all use the electronic medical records, and you see the speed of generating data. We use advanced laboratory systems, radiological and diagnostic systems. All of these are producing data in very high speed. But the question is, what do we do with these data? We are accumulating a lot of databases, but the question, do we have the capacity to analyze all of these data to generate insightful information? Just to give you a view of how rapid is the data accumulation. This graph shows the global data sphere. You can imagine the progress since or over the past 15 years. So 15 years ago, the global data sphere was less than 1 zettabyte. And I will explain what zettabyte is. But you can observe the exponential growth in data accumulation. So we are approaching 160 plus zettabyte, estimated in 2025. And just to imagine what 1 zettabyte is, it is the storage required to store 200 billion high definition movies that takes a person 24 million years to watch. You can imagine how much data we generate. But what's the proportion of this data that we analyze? We get actionable insight to change the way we practice, not only in healthcare, in all industries. Actually, it's too little. And the reason is that we are still held with our traditional and conventional analytical techniques that cannot yet handle this sheer volume of data. Without analyzing the data and the real-time data, we don't produce enough information to cope with the advancement. The problem in healthcare industry is that there are multiple reports, and I think Ms. Frial presented some information about that. Healthcare industry, when we compare it with the large business industries, it's one of the slowest adopters of the AI. And there are plenty of reasons for that, but I will not focus on all of them because there is a philosophical part of why we don't utilize AI in our practice. This is quite boring, so I will not talk about it now. But there is an interesting reason for that. Actually, one of the reasons is how healthcare professionals, scholars perceive AI. And just to summarize it, and this was part of my PhD, by the way, I managed to identify 4 stances where healthcare professionals, scholars, scientists perceive the AI. The first stance is the over-optimists. There are plenty of people, I think you came across many of them, who believe that AI will solve all the problems in the world, ignoring that AI will bring new challenges and complexities to the healthcare industry. So I think this is an extremist position, and we need to adopt more objective stance. The other extreme is the over-pessimists. These guys believe that AI will take over humans, healthcare professionals will be replaced by robots. It reached to some of the researchers to visualize or to describe the AI as a chimera, which is a mythical creature that has a lion head and a goat body. That means it doesn't exist. And they believe that at one point there will be human robot wars. I think there are too many movies about this subject. And eventually the healthcare will reach to this shape. The third stance, which exists everywhere, the people who have no idea or have no interest whatsoever. And if we will adopt an opportunistic approach, this group is a good target audience to bring them. So by convincing them or let's say explaining to them the powerful potential of the AI. So what shall we do? I think what shall we do is the fourth stance that I would like to encourage for. The first thing is we need to understand what AI is. And I will not repeat what Riyad said. I will focus on other perspectives. Simply, we need to envisage AI as a multidisciplinary scientific field because AI in itself has no value until it is integrated in a specific business domain. AI can compute, can analyze huge data in diverse forms that humans might fail to do. but the data originates from certain business field. Let's say healthcare industry is one of these fields. Then we can reap the benefits of the AI. And the bottom line is that the AI is a trial or an attempt to simulate the human cognition in order to solve complex problems. And it has multiple components: deep learning, machine learning, robotics, etc., etc. One of the key advancements that I think most of us deal with is the large language models. Now, I think most of us use ChatGPT for a reason or another. But be careful, because those who use it for scientific and academic reasons, it might give some false information. I'll not discuss all of that, but I think one of the most important fields, at least as I see it, is the precision medicine. I think you all hear of the genome project. I think that AI and machine learning technologies or techniques has advanced genetic sequences significantly. The old way of DNA sequencing was taking months. Now we are talking about a couple of days, and you will have the full DNA sequence. And this contributes very significantly to the precision medicine or the personalized medicine, which is the bigger umbrella, where we can detect some future diseases, and then we can tailor personalized or precise preventive, let's say, care plans. The robotic surgery, I think you all know what robots can do now in advancing our surgical accuracy, in addition to too many other fields, as you can see. Predictive analytics is the area where I am active, and I'll give just some examples of the work we've been doing. And I'm presenting this to encourage the nurses not to undermine their potential in what they can do in this field. Actually, and I'm not here to brag, believe me, I'm just trying to showcase a real life example, a recent example. I was privileged to lead a group of professionals in neuroscience department at Ahmad Medical Corporation, where we managed to obtain all the data in the National Stroke Registry. And here is the beauty of machine learning, because the researchers understand what I'm saying. We are always limited with what we can do because of the sampling limitations. Machine learning helped us to get rid of the sampling limitation, and now we can study the entire population. So this is a real life example. We published so far more than 7 papers. We deployed 2 models so far in our database to produce or to execute individualized predictions for certain selected stroke outcomes. So we took all the patients who sought care in stroke service in Ahmad Medical Corporation. We designed several algorithms to detect or predict stroke outcomes like short-term, mid-term disabilities, mortality, and some hospital-acquired complications. And all the algorithms produced decent to excellent predictive capacity. And now we are in the process to integrate this. Yeah. And now we are in the process to deploy these models to benefit from the predictive capabilities of these algorithms. I am leading this project, and I think a few years ago I was like a nurse in this room. So yeah. So I think every one of you can can start to practice research in the AI, and don't limit yourself with the high tech, let's say, propaganda, because you still can do a lot. Actually, I will talk about some applications, and particularly here, I'm focusing on the research. So these are areas where you can start researching. You know that there are plenty of wearables and monitoring devices that we use on a daily basis, inside and outside the hospitals. There are plenty of publications in that field. I advise those who are interested in this field to start reading the literature about it, because I think this is where we can make difference. These devices produce data in continuous fashion. And I think as I was saying, our computational techniques fail to some degree to analyze data that are produced in this speed. You know, we have published a few papers in utilizing the artificial intelligence in the triage. And I think the emergency nurses understand the value of triage in the emergency. It's not only a clinical decision to say treat now and treat later. It's a traffic light that control what's happening inside the emergency. And you know, if you don't control it well, then patients might fall sick, or the emergency will be extremely busy, which will affect life. And in China, they started to deploy some robots that help, improving the accuracy of triage. And I think in UK, they started, the NHS started AI-powered telephone triage system, where people can call and, certain algorithms can determine what the patient should do. In nursing care planning, this is a study that we published recently that talks about the capacity of large language models in helping nurses devise tailored nursing care plans. I advise you to go back and read about it, because it might sound very difficult, but it's more easy than you can imagine. And this is a good area for research. The tools are available for free. And I think this is a good venue for research. In education, this is another publication where we studied the opportunities for AI in enhancing education, especially ChatGPT, because it can produce or it can facilitate scenario-based education. And the educators know that better than I do, but there are plenty of opportunities. And here I don't want to be over-optimistic. There are plenty of challenges, but this is how we should address this. We need to reap the benefit while we are addressing the ethical challenges. In the wound care, you know that now there are plenty of organizations who developed huge databases, image databases, that they can sell to hospitals in order to help them improve their wound care practices. These technologies can help you classify accurately the wounds, help you devise personalized care plans, help you detect the progress of the wounds or the healing process. There are plenty of studies that discuss mechanical challenges where the nurses have low back pains, cause burnout, etc., etc. And this is in Japan. This is a true picture where they deployed some robots to help the nurses achieve their mechanical functions. And if you read the literature about it, it's very safe, achieves the target. Might sound now funny, but it's true. For the nursing managers, optimizing staffing level is one of the key challenges because we always regress to flat staffing. Whatever we try to do, cope with the dynamicity of the care demand, we always fall in the trap of flat staffing. And you know, when you have flat staffing, in some days you have understaffing, which introduces risks. Sometimes we have overstaffing, which is cost ineffective. Machine learning produces or helps design algorithms that can capture the dynamicity and advise the nursing managers to optimize the staffing levels. And this is a publication where we studied some of these models. The second reason for why we slowly adopt the AI is, as Riyal said at the beginning, there are plenty of ethical limitations. There are challenges to the key ethical principles. I think most of us know the medical ethical principles: justice, autonomy, beneficence, and non-maleficence. And in order to take an objective stance, we shouldn't shut our eyes on that. And this, by the way, is a great field of research for the people who don't want to, engage in the very sophisticated technical functions. They can study how these limitations can be addressed appropriately. Finally, the message is that AI can help save lives, personalize the care, improve efficiency, and improve decision making. It's not more intelligent than human being because there is always a human intelligence behind artificial intelligence. However, AI can process more variables at the same time. As Mr. CEO said, AI will not replace the human touch. It's still needed. So for the pessimists, it's not true that robots will take over our jobs, at least for me. AI tools help us do better work, better processes, better analysis. So the message is, let's understand AI, address the challenges, reap the benefits for the improvement of the healthcare system. And the wisdom of the day, AI is coming, whether we like it or we don't like it. It has the potential to revolutionize any business industry, including the healthcare. So the advice to all of us, let's embrace it with open arms. Let's take the benefits. Let's adopt somehow a pragmatic approach where we can capitalize on the benefits that can be reaped by the healthcare providers. I asked ChatGPT whether AI is intending to take over the healthcare providers' role. And the simple answer, straightforward, definitely not. It's there to help us do a better job in multiple aspects. And thank you very much.
And Doctor, would you like to have a seat for a while as we have some questions for you from our audience? First question, Doctor. This is an interesting question. How does artificial intelligence support patients in managing emotions like happiness and sadness through personalized approach?
Actually, as I said, when it comes to emotions, I think this is exclusive to human being. However, personalized care, since it addresses the individual patient's needs, then this might have a psychological impact related to satisfaction. Can you hear me?
Yes.
So, as I said, we cannot, until now at least, we cannot infuse emotions into the artificial intelligence tool, so the humans are still needed. But just to re-emphasize what I was saying, personalizing the care can enhance the patient satisfaction of the care.
Thank you, doctor. There's another question. Sorry, we have a very eager audience. Another question is, how can understanding the limitations of AI help healthcare professionals make better use of these technologies?
Yeah. Actually, there are plenty of ethical challenges. One of these is the potential of the AI to breach privacy, confidentiality. There is a challenge of consenting, and these are hot subjects in AI because, we produce data in a passive approach, which means that we don't ask the patient to give us data in a structured form, like when we collect surveys or whatever. The data are collected passively by monitors through the medical records, and these data are not collected for research purposes particularly. And here is an issue where patients need to be fully orientated how their data will be used, what the risks are, etc., etc. So it's a message for all the healthcare providers that they need to go and understand deeply how utilizing AI in their practices would affect the medical ethics, privacy, confidentiality, etc., and address each one.
Okay, thank you for that, doctor. There's another one. Okay, how can AI be effectively integrated into healthcare processes to complement human touch rather than replace it?
Yeah, actually, as I said, I'm not a believer that it will be replaced, at least for now. AI cannot produce emotion. At the end of the day, the developers are producing algorithms or robots, etc., to do certain functions according to human order. I presented some examples where AI can help decision makers predict certain complications and tailor preventive care plans. We presented how managers can benefit, let's say, from the machine learning in order to deploy dynamic algorithms that help them assign adequate level of staffing, which reflects positively on the patient care. So the bottom line, AI is there to complement in many aspects, particularly in supporting clinical decision.
Thank you, doctor. That would be all.